Hi everyone, our topic today is destigmatizing and rising awareness of psychological services. We are going to talk about an overview of mental health in Malaysia, stigmas and barriers to seeking mental health in Malaysia, promoting awareness for seeking mental health services, and the take-home message. In the late 1890s, the mental health treatments were remain custodial in nature. There was a revolution of mental health care provision in 1958, in which the mental health service users were not treated as a psychiatric patient. In 1961, the first psychiatric practitioner in Malaysia had appeared. Then, the community-based rehabilitation of mental ill persons had been formed as a day care center. From 1975, there were almost 100 psychiatrists who had started to serve in the community. Besides, the University of Malaya had provided training to cultivate local psychiatrists. The government hospitals had also established a psychiatric unit and the mental hospitals to receive more users. In addition, the Ministry of Health had developed the National Mental Health Policy in 1997 and introduced the new National Mental Health Act and the National Mental Health Register to spread awareness of mental health.
Now, we will talk about the overview situation of counseling and psychotherapy in Malaysia. Malaysian counselors and psychologists are well defined on the multicultural differences, as Malaysia is a multicultural society and we have three main races: Malays, Chinese, and Indians. Counseling in Malaysia began with school guidance in the 1960s and has now achieved recognition as a profession in school and community settings. The types of community counseling services available are telephone counseling, face-to-face counseling, and support groups. Besides, for psychotherapy, it did not develop until the 1970s. It was mainly used for non-psychotic patients such as depressed or anxious. The most common form of therapy in the 1970s and 1980s was psychoanalytic therapy. Slowly, behavioral therapies and cognitive behavioral approaches were introduced. However, there are some changes in the situation of counseling and psychotherapy because of the COVID-19. The current situation is clients having online counseling and therapy as mental health services can no longer be done face-to-face because we must have physical and social distancing during the counseling process. E-therapy is affordable and effective to treat psychological and emotional distress at the individual convenience. It will also strengthen online virtual care to help stop the spread of the virus. Currently, Malaysian society is experiencing some challenges. By 2020, mental illness is expected to be the second biggest health problem affecting Malaysians after heart disease. Every 3 in 10 adults aged 16 years and above in Malaysia suffer from mental health issues. And because of this, counselors and psychologists are important. Adequate offerings of help and programs to highlight such occurrences could have played an important role on the increase of mental health issues. In every organization, a counselor and psychologist is a need to assist individuals who seek help mentally, physically, and emotionally. Counselors and psychotherapists have to focus and put time in creating awareness for mental health services.
In most government and private hospitals, psychiatrists, clinical psychologists, and counselors can be sought. However, the fees in private settings are more expensive than that in government hospitals. In NGOs, commonly, there are more lay and registered counselors, while in university centers, there will be the lecturers who also be the registered counselors serving the client. In Malaysia, there is a lack of psychiatrists and psychologists to provide mental health services, and even worse, they are not evenly serving in all the areas of Malaysia, which did not meet the suggestion of the World Health Organization. There are only 148 registered counselors are serving the Ministry of Health, which means that there is an insufficient number of counselors in the government settings. Furthermore, the ratio of counselors to clients in Malaysia did not meet the normal condition.
We shall now move on to the stigmas and barriers when it comes to seeking mental health services in Malaysia. First of all, what is stigma? Stigma are marks of disgrace and shame. Those who bear those marks of disgrace, aka stigmatized, may be rejected and disapproved because they bear certain types of traits that are considered undesirable. Generally, there are three types of stigmas that prevent people from seeking help for their mental issues. They are public stigma, close others stigma, and self-stigma. Public stigma are stigmas that are presented by the society. An example of it would be the community assuming that one will develop changes in their personality or start depending on drugs if they were to start seeking help for their mental health issues. Close other stigmas are stigmas that are presented by those whom we interact with. An example of that would be us not wanting to seek for mental health services because we feel that our family and our friends will feel ashamed of us. Lastly, self-stigmas are stigmas that we induce on ourselves. An example of that would be us not wanting to seek mental health services because we do not want to see ourselves as being weak or inferior. Stigmas can result in social isolation of the stigmatized individual. And when that happens, it prevents the individual from getting the social support that they need to overcome their mental health issues. The stigma surrounding the mentally ill and those who seek help for said issues are related to one another. The stigma surrounding the mentally ill are usually about the individuals being crazy or dangerous. On the other hand, the stigma surrounding those who seek help are usually because that they are too weak. Which brings us to the issue where people are reluctant to attend counseling or therapy for the fear of being labeled as weak. The label of being weak can be given by the society, which is public stigma, or by people that we know, such as our friends, family, and colleagues, aka our close other stigma, or by that individuals themselves, which is self-stigma. Unfortunately, it has been discovered that while all three stigmas are correlated to not wanting to seek counseling, self-stigma is most significant in predicting not wanting to seek for counseling. In cases like this, it shows that we are our worst enemy.
There are several barriers that Malaysians face when wanting to seek help for their mental issues. One is that our citizens are unaware that there are mental health facilities and services in their communities. This indicates that the awareness on mental health services in Malaysia is very limited, and that Malaysia does not put much emphasis in ensuring the mental health of their citizens. Furthermore, as Malaysia is a multicultural country, there are cultural influences when it comes to interpreting mental illnesses, and that can potentially lead to barriers for one to seek help. For instance, there are those who believe that mental illnesses are caused by a curse from God, bad karma, or even black magic spells, which are based on supernatural beliefs rather than scientific reasonings. For Chinese, some of them may give reasons such as being possessed by the dead. For Malays, they provide reasons such as breaking the rules of Saka, a belief in the Malay community about genies and fairies. For Indians, they associate mental illnesses with bad karma. When that occurs, their methods of curing those illnesses end up being cultural and supernatural in nature, such as visiting witch doctors and consuming traditional herbs. Some who are more religious tend to rely on prayer and religious leaders to cure said illnesses. The lack of awareness of what mental illnesses are leads to the community thinking that their mental illnesses are due to God cursing them or having bad karma, or because of black magic curses. And that can prevent individuals who suffer from mental health issues to seek the proper care and treatment that they need.
As psychology students, what can we do to promote awareness of mental health services in Malaysia? What can we do to break the stigma of mental health as mentioned above and seek help for it? Below are a few suggestions that made by our group members that we can carry out as students. One idea is to utilize social media to spread awareness regarding the topics of mental health. We plan to gather information from various mental health websites and create simple and easy to understand infographics and share them to the public. Examples of the topics shared include comparison of services provided from psychiatrists, psychologists and counselor, a comparison between mental health services provided by the public and private sector and non-governmental organizations (NGO), introduction of few NGOs in our country like Mentari, steps to seek professional help as well as emergency hotlines for those who need immediate help. Here is a quick view of how it looks. The meaning behind this activity is to help summarize vast information found on the web and present it in a simple manner to the public, which hopefully eases them the time of research as well as help them better understand what is offered and what can they do to help themselves as well as those around them. Other than that, a heart-to-heart session can also be conducted, especially during this time of the pandemic where we have to isolate ourselves, which might cause loneliness. Individuals who are mental health professionals, those with mental illness, those who recovered from mental illness, or just individuals who are interested to chat and understand more are welcome to join. During this session, participants are encouraged to show their love towards each other and ask appropriate and caring questions. The idea is to create a non-judgmental and comfortable environment for participants to share and engage with each other. The reason for organizing this is to promote peer and caregiver support as well as the idea that no one is alone and that there is always kindness around the corner. All they have to do is just reach out. Sharing your story not only aids in recovery, but also encourages and provides support to others with similar experiences. Another idea proposed is to invite professionals from Mentari, a community mental health center initiative by the Ministry of Health, MOH, to talk about mental health to the public. At least one Mentari can be found in every state, with Mentari Selayang as its central coordinating center. Organizing talk not only educates the public about mental health and mental illness, it can also normalize the discussion of mental health and illness among the public and hopefully increases the tendency to seek help when needed. Other than that, the public can better understand what services are provided around them and which area each professional specializes in. We hope by giving more talks, the public can get used to the topic of mental health and be more open about seeking help.
Moving on, we would like to promote early screening of mental illness through social media, as this can encourage people to take action regarding their mental health. There are many valid self-assessments that we can take to get a rough idea of our state of mind. One of the widely used screening tools is the Depression, Anxiety and Stress Scale, DASS-21. It contains 21 questions that measure the emotional state of depression, anxiety, and stress. There's evidence of the validity of the DASS for the use in both clinical and community settings. Of course, to really know for sure whether we have a problem or not, we would need to see a professional. However, this assessment can be a starting point in our journey towards a better mental health. Another idea is to organize a green ribbon wearing campaign. This campaign aims to get as many people as possible to talk about mental health to end stigma and discrimination. By wearing a green ribbon, which is an international symbol for mental health awareness, we are actually creating a safe space for people to talk about mental health. We let our friends, family, or simply those we walk past to know that we care about their mental health and that we are there to support them. So, what can participants do to support the Green Ribbon campaign? They can post a photo of themselves wearing the green ribbon on the World Mental Health Day, which is on the 10th October, and tag their friends and hashtag Stop the Stigma. Besides, we can promote mental health volunteering among university students. We can provide a list of mental health organizations for students to volunteer. For example, Befrienders offer an opportunity for people to volunteer to help others in emotional needs. This experience will help prepare you to listen in a more open and non-judgmental manner. Joining the mental health volunteering events can also nurture a sense of community awareness and social responsibility among university students. And last but not least, we can have a mental health awareness bingo challenge that consists of 9 items such as sharing mental health infographics and attending mental health talk. How does this challenge go? First, they need to save a picture of the mental health awareness bingo board. Then they cross off the things that they have done during the mental health awareness month and share their bingo on social media. They can nominate their friend to take part in this challenge by tagging them too. Even if they don't struggle with mental illness, this is an opportunity for them to inspire others to raise awareness and take part in sharing of information and support for mental illness.
However, promoting awareness is only the tip of the iceberg. There is so much the government can do to help if it is willing to see change in Malaysia's approach to mental health. The Venn diagram shown on this slide demonstrates the many areas we can improve. For instance, The high prices and low availability of basic counseling services feeds into the perception that seeking treatment is only useful as a last resort. Additionally, the government could provide aid through subsidies and other economical means to aid NGOs in reaching out to vulnerable communities. Better preventative measures can be set in place to curb the volume of severe decline in mental health in the public. In other words, prevention is better than cure, and instilling proper education on self-soothing techniques, mindfulness, and simply being aware of one's thoughts and emotions can empower one to take charge of their own mental health. This can be done through programs in schools and workplaces that teach individuals to develop introspective and reflective thinking. Finally, it is vital for the government to ensure that there's proper quality control enforced in mental health treatment facilities. These include basic anti-discrimination laws that protect all individuals no matter their background. Furthermore, the government should invest in the future of mental health services through empowering students to pursue tertiary education in psychology, psychiatry, social services, and more. In the long run, creating a job market in the mental health sector, whether as in a private clinic setting, hospital setting, or simply academia, would quicken its growth and hopefully facilitate a positive cycle of promoting mental health awareness, providing more avenues for treatment, and in turn, normalizing treatment. The aforementioned points can be summarized by the World Health Organization's initiative to improve mental health treatment around the globe by 2030. Other countries we can learn from when considering ways to improve mental health services in Malaysia include Luxembourg and Switzerland. Luxembourg has instilled a positive education curriculum in schools which normalizes discussing mental health at a young age. Since instilling this program, Luxembourg has seen a decrease in school dropout rates, higher student well-being, and achievement levels. In Switzerland, the government has made it compulsory for all residents to have mental health care insurance. These insurance policies are regulated by the government to ensure there is minimal preferential treatment of patients on the basis of their insurance. Additionally, to reduce the incentive to stay in treatment in the long term, rates decline as length of stay increases. The effectiveness of such policies is especially notable in Switzerland, as the country has a high number of psychiatrists, but also lots of beds and discharges, and low unemployment.
So what do we wish for you to take home from us? All in all, we would like for you to know that mental health is a perfectly normal thing, much like our physical health. When we are ill, we head for the doctors, and the same applies for mental health where we seek therapy and counseling. We would like to share with you phone wallpapers that we created, and we will continue posting on Instagram to further raise awareness on mental health and its services. Just like the quote from Glenn Close, what mental health needs is more sunlight, more candor, and more unashamed conversation. So these are the examples of the phone wallpapers that we created. For our mascot, we decided to go with the fox, so please meet Fred the fox. We chose the fox as our mascot because foxes are known to be adaptable and resilient in tough situations. They also represent wisdom when it comes to dealing with difficult incidents. Just like our mental health, what we strive for is to be resilient and adaptable when dealing with difficulties. Although undoubtedly, we will face things that are too bearable for us to cope. But just like the fox who symbolizes wisdom, this is when we should be wise and seek help when we need to. There is no harm in seeking help. In fact, it is the greatest show of courage, adaptability, and wisdom. So these are the example of feed posts on our Instagram. And these are the posts themselves up close. We hope that you have gained new insights about mental health from our presentation. Thank you for your time.